Hello, doctors. Now we are going to see some important MCQ related points from Concordance Repertories. Okay. The word first used by Dr. Boning Hassan in Therapeutic Bucket Book. This is important MCQ. The word concordance used by Dr. Boning Hassan in Therapeutic Bucket Book. Okay. In his book, this chapter is added in last concordance chapter. So their relationship of some medicines are discussed. Okay. After that, the concordance word replaced by relationship of remedies by Dr. T.F. Allen. Okay. Concordance means what? Original symptoms of materia medica will be there without much changing in the language of patients. Usually in repertory, we have some repertory language. But here, in case of concordance repertories, that changes will not be there. Okay. Here, up to this, first important is who used first the word concordance. Answer is Dr. Boning Hassan. After that, replaced by relationship of remedies by Dr. T.F. Allen. This is also important question. After that, you have to know about what is concordance. Okay. Now moving to Generic Concordance Repertory. This is a long concordance repertory published in 1890. Totally 420 medicines. Plan came after the Concordance of Bible. There are 6 volumes in here. Let's see one by one. Decide volume, numbers, and content. Here, in volume 1, you can see mind and disposition, head and scalp, ears, eyes, nose, face. Similarly, in volume 2, you can see that mouth, throat, stomach chapters. In volume 3, you can see abdomen, anus, rectum and stool, urine, urinary organs, male sexual system. This 4th volume is very important one. Frequently they are asking in exams. Okay, 4th volume, what are the chapters we can see? Uterus and their parts, then menstruation, then discharge, pregnancy related rubrics, parturition, lactation, mammary glands. Okay, 4th volume is very important. Then 5th volume, here you can see that voice, larynx and trachea, chest, lungs, and then heart, and then fever related chapters. Finally, sleep, even skin and sleep and dreams. Okay. In final volume, that is 6th volume, neck, back, upper extremities, lower extremities, bones. Finally, nerves and generalities and keynotes. Okay. Here, in exam, they can ask any chapter after that which is present in which volume, like that they can ask. Okay. Mainly 4th volume is important. Just you can remember the anatomical arrangement. According to that, you can easily answer. Okay. Moving to next repertory, that is NER repertory. Repertory name is Repertory of Errings Guiding Symptoms of Materia Medica. Came in 1896. Author Galvin by NER. Okay. There are 408 remedies. Main source is Herring's Materia Medica. 48 chapters. Start with mind and disposition. Ends with drug relationship. Here also in a repertory also we can see some different rubric, different chapters. Like 24th chapter is pregnancy, parturition, lactation. 36 is nerves. 47 is stages of life and constitution. This chapter's name is important. Okay. Sometimes they can ask this chapter present in which repertory, like that. Next, about other works of NER. What are the other works by NER? Okay. A Repertory of Headache in 1894. Then Drug Relationship in 1936. Then Conversation Talks Life and Time of Herring in 1940. This is also important part. They can ask about the name of a repertory and the year. Okay. I repeat again, in a repertory you have to remember the year, author, number of remedies, number of chapters, then different chapters like pregnancy, constellation, lactation, nerves, then stages of life and constitution, and then what are the other works by Ner. Okay, moving to abbreviation. Here, abbreviation is very important. Okay, they can ask. First, double thick vertical lines means symptoms are repeatedly verified. This is the highest value symptoms. It's the highest value. Okay. Next, single thick vertical lines means just verified by cure. Next, double ordinary vertical lines means it can come in frequently or sometimes confirmed. If once comes means it proved the genius of remedies. So it has lowest value. Okay. Next is perpendicular dot lines. Just for observation. Okay. T means T is very important. Very important. T means toxicological event. Okay. Q means standing between cured symptoms and pathological conditions. Then pi. Pi means pi also very important. Observed in sick individuals means clinical symptom. Next, hand sign also very important. Cross reference. Okay, these are the abbreviations which is present in Repertory. First is double thick lines, highest value, frequently verified. Single thick line, just verified. Then double ordinary vertical lines means it can come more frequently also or one time one also. Once it comes means it comes with a genius of remedies. Main symptoms comes like that. Means strain of the patient comes like that. This is have lowest value. Then perpendicular data lines, observation, T means toxicological event, Q means standing between cured and pathological conditions, Y means observed in sick individuals only, that is clinical symptoms. Next, hand sign means cross references. Okay. Next, we'll see about comparison. Here, we saw only about two repertories. First is repertory, second is genre. Okay. Here, I have put here separately chapters just for easy understanding, final revision. Okay. The repertory came in 1896, totally 48 chapters, 408 medicines. In case of genre repertory, it came in 1890, 6 volumes, totally 420 medicines. Okay. Next, now we saw about nerve chapter in genre repertory also and repertory also. Apart from that, which repertory? Murphy repertory. Okay. Nerve chapter present in Murphy repertory, genre repertories, and nerve repertory. Then stages of life and constitution present in repertory, that is 47th chapter. And then a repertory of temperaments, disposition, constitution states present in Clark repertory. Actually, here I forgot to mention. This is Clark repertory. Just note your notes. Okay. That's all about concordant repertories. Thank you.